Bring Tammy Ryan up for us now. Tammy is with the Wisconsin Department of Natural Resources Bureau of Wildlife Management, has been the chief of the Wildlife Health Program since 2009. She served with the Bureau since 1994 and throughout her career. And chronic wasting disease has been a predominant issue and her primary duty. She states that she vividly remembers whenever Wisconsin first detected chronic wasting disease in their white-tailed deer herd, and has been engaged in CWD management in various leadership capacities during a 16-year time frame of management response. Tammy is a University of Wisconsin Stevens Point alum and has been married to her husband Steve for 24 years, enjoys hunting and recreating on their 160-acre property in northern Wisconsin, and is a happy owner of 2 English setters, Belle and Ruby.
So good afternoon. Thank you very much for inviting me to come here today. It's been an excellent day hearing all these presentations, and I really appreciate the opportunity to be able to come here to Texas and to share with you the Wisconsin story, as I like to say, on our responding to and managing chronic wasting disease. And as my introduction indicated, I've been involved with this issue of chronic wasting disease since the onset of it, when it was first detected in February of 2002. So I stand here today just 2 months shy of our 17th year anniversary, which is just amazing to me to be here and look back, and 17 years have already gone by, and that entire 17-year time frame I've been deeply involved in this issue in Wisconsin. At the time that CWD was detected in Wisconsin, it was definitely unwelcome news. It was the first time chronic wasting disease was detected east of the Mississippi River. So it's a similar kind of, as you remember 9/11 or other things, it's just memory, burned in your mind. And I can remember being at this meeting and all of us getting pulled out of the meeting by our bureau director, and we knew that this wasn't going to be good news, and certainly it wasn't. So, deer hunting, as it is in other states, is immensely important to the state of Wisconsin. It's deeply rooted in our culture, lots of family traditions, and also obviously very important to the economy of Wisconsin as well. So when I look back on our 16-year timeline, I essentially break it down into phases of management, and I see, in my mind anyway, I see there being 4 primary phases that we've kind of worked our way through. And I'd like to share with you today, I guess, my perspective or my viewpoint as to kind of what it was that shaped each of these phases. And also, I would offer that each of these phases in our management to this disease has been, in effect, a new beginning or a new approach to our management. So the first phase was the first 5 years following our detection in February 2002. And at that time, we embarked upon a pretty aggressive response. We conducted disease assessment surveillance right away. We formed an incident command center. Then following that winter right into the spring, there's a special legislative session. We adopted emergency rules to be able to, and formed an interagency team too with our state partner agencies to develop these emergency rules, to go to the legislative session and ultimately give us these special authorities for doing culling in the summertime or outside of the season. We enacted baiting and feeding ban. And then we also, during this 5-year time frame, we conducted 2 statewide sweeps of CWD detection surveillance. We also established and hired CWD biologists, so we really amped up our operations response so that we could do landowner outreach, not only to help share the information and the seriousness of this finding, but also to facilitate relationships with private landowners and get access to lands to be able to manage try to manage the disease on the landscape. We implemented extended seasons, as Brian Richards did a really great job setting the stage here today for my talk. We had extended seasons, that long gun season. We also had landowner seasons that went beyond the normal season, well into the winter. That all popular management tool, Earn a Buck, and then as well as conducted agency sharpshooting. So during this 5-year time frame, our agency expanded about $27 million on this important work. We also, during this time frame, we offered reward incentives for harvesting deer. So we had this payment for positives. With every positive deer that was harvested, $200 went to the landowner, $200 went to the hunter. We also developed a food pantry program because we learned that hunters only want to harvest as much deer as venison as their freezers will hold, and we wanted more deer to be harvested, so we established a food pantry program. And then we also enacted baiting and feeding bans. And this is a really intensive time period, and in the words of one of our previous now retired bureau director, we put a good shoulder into this effort. But yet after the first 5 years, we came to the sobering conclusion that we didn't have the level of impact on the diseases that we had hoped to. And so we knew that we needed to basically reassess where we had been to inform where we were going to go for the next iteration of our management and response. So in 2007, that's when the second phase of our disease management began. And at that time, we kind of reevaluated. I didn't mention that when we developed our disease management plan in the first 5 years, we did identify a disease eradication strategy or goal, I should say. And after the first 5 years, we reassessed that goal, and we reestablished a goal of containment, control, and then eventual disease eradication. And so we decided to embark upon a stakeholder process, and we knew that we needed to bring the stakeholders in our state along with us into the future of our management and our approach. And we learned that we needed these landowners to help us decide what it was that our management response strategies should look like, as well as help us to identify what tools might be palatable to the public, as well as what the consequences might be of not fully maybe being successful in our response, and are we willing to accept that we might not be successful. And so we asked these questions with this appointed citizen advisory group, which is 18 citizens, and they met for about a 6-month period, and at the conclusion of that period, they developed recommendations that ultimately informed our CWD response plan. So the recommendations that this advisory group considered kind of spanned this continuum, and ultimately, as you can see, the stakeholder advisory group landed on the middle of slowing the spread of the disease. And so they developed recommendations that kind of, basically were focused towards that end. And so that then informed the plan for managing chronic wasting disease in Wisconsin for a 5-year period. And that was then taken to our Natural Resources Board, which is our governing body for our agency, in 2009. And however, at that presentation of those recommendations, the Natural Resources Board actually tabled it and said that the plan didn't go far enough in managing the disease. They appointed an expert panel that reviewed the plan and brought their recommendations back forward to the department. And as a result of that, we basically redid the plan, and ultimately it became no longer a management plan, but it became a response plan. And also, instead of having a 5-year time frame, we have a 15-year time frame with 5-year reviews. The goal of that response plan for the 15-year time frame is to minimize the area of Wisconsin where CWD occurs and the number of infected deer in the state. And this plan is broken down into 6 key objectives with 27 action items focused on preventing disease, as well as monitoring for disease when it's found, seeking to manage the disease when it's found, also providing outreach action items towards public outreach, as well as the use of the public as management, basically as aiding us in our management response. Also, customer service is an important component, as well as is enhancing the scientific information of CWD. So this then brings us to phase 3, starting in 2010, when the CWD Response Plan was then adopted by our Natural Resources Board, and then we then began implementing it. And at that time, however, in 2010, we were already tracking increasing trends in prevalence and distribution. And this phase also included some new experiences or strategies in responding to CWD. So for example, in 2011, when we had a response that we had a lone positive in the wild in the northwestern portion of our state, a citizen advisory team was formed, and to this day, that team of citizens is helping to guide our response to that lone positive in that portion of our state. Also during this time frame of phase 3, there was a new initiative by Governor Walker in which the state of Wisconsin contracted with Dr. James Kroll. He's also known as the Deer Trustee at the time, and Dr. Kroll conducted an independent review of Wisconsin's deer management practices. And that process also involved another intensive public input process. The recommendations were presented to us, our agency. We took it forward to the public through a 5-month process where we had teams of citizens form committees. We had a deer herd health and CWD committee. There were 14 recommendations that Dr. Kroll and his colleagues recommended in regards to CWD that process ultimately considered. And then in 2014, new rules were put into effect. And those rules of the Deer Trustee report really had a significant impact on chronic wasting disease management in our state. Also during this time frame, we had the primary source of our CWD funding to date was identified, and that is a $5 antlerless fee for chronic wasting disease. So essentially, when tags are sold for antlerless deer harvest in CWD-affected counties, we get a $5 earmark, if you will, that goes into our funds for chronic wasting disease management. We also used to have a structure of management that was based on deer management units, which is the map on the left in the shades of gray. And then as a result of the implementation of the Deer Trustee report, we now manage by county. We no longer have that structure, and now we manage by counties. We also added citizen deer advisory councils. So this is another citizen process where every county of the state has a council that works with us on managing deer in those individual counties, including contemplating deer herd health scenarios or within each county. Also, at this time, our season structure changed. We used to have the earn a buck tool, and then that changed to bonus buck. So basically, if you shoot a buck, you can get a tag to shoot another buck. But eventually in 2014, that tool was eliminated as well. We also used to have a CWD management zone in the southern part of the state. And as a result of the Deer Trustee report process and the recommendation to take a more passive approach to CWD management, this zone went away. And now we basically refer to it as our endemic area, because this is where our CWD is established, and it's basically here to stay. And from that approach, now we go to CWD-affected counties. So a county is designated as such if there's a positive detection in either the wild or in captivity, or if the county is within 10 miles of such findings, a 10-mile radius of such findings. And when that radius hits a county, it pulls the entire county in. So as a result, we now have a much different, map and consideration for CWD on the landscape than we used to with the southern management zone. Also, beyond the Deer Trustee report, however, during this phase, we also implemented some field testing operational efficiencies. As Dr. Samuel referenced, we've been doing weighted disease detection surveillance since this time frame. So we're working really closely with licensed taxidermists, for example, as a way to get samples. We also in this time frame, when our in-person registration that used to be required for a long, long time went away. We now have electronic registration, so we don't have the ability to get our hands on deer physically to get the samples. And so we've been adapting, since 2014, we've been adapting to the electronic registration and trying to really, increase our sampling. So then, phase 4 is started in 2016 with our first review of our CWD response plan. So as I mentioned, we do 5-year reviews, and it was due to be done in 2015, or 2016, excuse me. And so our Natural Resources Board directed us to get going on that first year, 5-year review. However, in the spring of 2016, there was another initiative by Governor Walker on chronic wasting disease, and including working with the public, those citizen deer advisory councils that I referenced earlier, to get input from them on our CWD response plan and what the next iteration of CWD management and response would be in our state. So this is our third intensive public process that has informed our CWD management and response. And in October of 2016, our CWD Response Plan Review Committee was formed. And this was also done in partnership with our Department of Agriculture and also the Wisconsin Conservation Congress, which is, we're the only state in the nation that has this Conservation Congress, which is another citizen body where there's delegates in every county, and they also are advisory to our Natural Resources Board. So working closely with our partners, we identified a new committee, our CWD Response Plan Review Committee, which consisted of 19 members of non-governmental organizations that all have a stake in addressing chronic wasting disease. And then after that process, they reviewed the plan, they developed recommendations. We went forward in January of 2017, where we had public hearings in every county of the state. So that's 72 public hearings to review our CWD response plan and our strategies going forward. And so utilizing that citizen engagement process was really important. And in the end, we brought forward the recommendations from that effort to our Natural Resources Board in March of 2017, when those were updated. And so as a result of that effort, since March of 2017, we now have an implementation plan for our CWD response plan. And that implementation plan actually now has, we still have the same 6 objectives that I mentioned before, but instead of 27 action items, we now have 62. And of those 62 action items, we have 115 implementation steps. So we definitely have, our work cut out for us, but it's also, again, a new beginning, a new focus, a new emphasis on chronic wasting disease in our state. And then we're providing annual updates to our Natural Resources Board too, which is a new thing as a result of that process, which is a good thing. We can come forward and provide updates to our Natural Resources Board now on an annual basis. Also, the governor, in his CWD initiative, he did provide some significant source of funding to do some research on CWD in Wisconsin. As Brian mentioned, the Southwest Wisconsin CWD deer and predator study is occurring in the southwestern portion of the state, in an area where there's high prevalence and low prevalence that's being compared and contrasted to see how CWD might be influencing deer, basically population dynamics. And so, we've long had a point of criticism, or, from the naysayers, I guess, of, well, that's, if we point to out west and what's happening out west, and we've heard about that today with the populations, that's out west, it's not Wisconsin. So now we have research that we're entering into our 3rd season, so ultimately, we've already documented some impacts of CWD on the population. So it'll be interesting once the 4-year time frame is over to ultimately see what those conclusions are. We've also really kind of been growing CWD research interest and support in just recent times. We have, on top of that, because we have the opportunity to have our hands on deer in a CWD area of our state, there's additional research endeavors that are that are coming on board in that regard too, in that area of the state on genotyping and looking at prion assays and modeling. And then we're also looking at research on deer disposal and infectivity of deer carcass waste, and looking at ways to dispose of deer carcass waste that might render CWD prions or denature them or make them less infectious through composting. And then also looking at prion persistence and infectivity in soil. So we've got some pretty exciting research endeavors that are on the horizon as well as well underway. So looking back on this whole time frame, I think in my mind there's some primary lessons that we've learned along this 16-year, almost 17-year timeline. The first being that managing disease in a wild deer population is challenging. Certainly, one doesn't have to live it to understand it, but that's been our experience here in Wisconsin. And I can personally attest to the fact that where we are now in Wisconsin is not where we had hoped to be back in 2002. And despite all the strategies and efforts that we implemented, what we know now that we didn't know then is that the disease was likely on the landscape for 1 to 2 decades before we found it. And through our timeline of 16 years, we have sampled over 215,000 deer, and we have detected over 4,500 CWD positives. And then we've also, documented the increasing trend in prevalence in all age and sex classes, as well as the increased distribution, and now having that 55 counties designated as being CWD affected. Lesson number 2 is that public support is key to achieving success. So certainly bringing the public along with you as you're planning and responding to the disease is an important lesson, as is the messaging that you use. So when we first started out in that first 5-year time frame, when we said we sought out to eradicate the disease, what the public heard was that we were set out to eradicate the deer herd. And that really didn't play out well, and we're still suffering from that to this day. So choosing your words wisely is really an important lesson. Also is, as Mary mentioned, communicating a time frame for a response. I really believe that if we would have at the onset set stepping stones or benchmarks and told our public that we're going to do this for 5 years and we're going to assess, and we're going to do another 5 years and then we're going to assess, similar to what the state of Illinois has been doing, I really think that is something that maybe would have helped maybe lessen some of the negative public perceptions that ultimately evolved. And also investing in communications is really important, and keep so that if you can message and work with the public in a positive way, ultimately in the end, all the tools that you'd like to have in your toolbox in responding to disease management will be readily available to you. Without that, you lose tools in the toolbox. And what we've learned along the way is that deer hunters can be your greatest ally and supporters in responding to disease, to this disease. And then the lesson number 3 is that adaptation is the name of the game. So we've certainly experienced many changes along the way, and we've experienced several collaborative processes that were pretty intensive and involved a lot of the public. And each of those processes has served as a reality check for our agency. And so basically we've been trying to strike a balance between managing a disease and a very trusted natural resource, but also trying to work with the public and maintaining their support along the way. So this threat of CWD to deer and deer hunting has, and the way that we've changed our approach over our timeline, I think exemplifies that we've been trying to strike that balance. How am I doing on time? Okay. So that's like my 30,000-foot overview, and I thought I would just take a moment then to just provide a state of where things are at with CWD right now in Wisconsin. And so I already mentioned our 55 affected counties. This map on the left-hand side just kind of shows that difference between the counties that have had detections in the gray shaded areas are the counties that have had detections in either wild or captive, and then the dark shaded areas are just the adjacent counties. So that's why we have 55 affected counties, but that doesn't mean that we have CWD in all 55. You take that one detection, draw a 10-mile radius around it. If that 10-mile radius hits a corner of a county, that entire county gets pulled in and designated as CWD affected. That's what we are obligated to do per the authority that we have. So it's important also to qualify that of the 55 counties that we have as CWD affected, 25 of them have had detections in the wild. So not all 55 counties have CWD detected. We also have had I've already highlighted these findings. The upper table, though, is representative of that southern farmland or the endemic area that I referenced earlier. And then also we have this column that just basically shows our testing turnaround time, which has really been an important point of emphasis for us, and especially in recent years. And we certainly every year are trying to strive to get those test results turned around to our hunters as quickly as we can. We have a couple of key challenges that we're facing, and certainly the increasing prevalence and distribution is one of them. This particular graphic is in the core area, and as you can see, the blue line for adult buck prevalence is over 50%. This is an area that we refer to as Wyoming Valley. We're very concerned about what the disease may be doing on the landscape there, but we have yet to document those population level impacts, but we believe that they're happening, and this research that's currently ongoing may ultimately support that. But we also have increasing changes in carcass disposal, and I would say that carcass disposal, I've learned a lot about solid waste management in this position, that more so than I ever thought I would. And certainly this year, for example, we had a landfill that made a corporate decision to not accept deer carcass waste. And as a result, there's a huge gap in the landscape in the western part of our state where there's no convenient way to dispose of carcass waste any longer. There's still options, however, those options are more costly now because you have to go further with that carcass waste. And the reason being is that there's concerns from wastewater treatment plants that the prions are getting into leachate, and that leachate then goes to the wastewater treatment plant, and that biosolid gets spread on the landscape. And there's concern about the prions being infectious and creating either more deer disease or potentially disease in cattle or even humans. So there's like a liability undertone there for sure. So we've definitely trying to find solutions to bring us into the future on that. This is just a graphic that shows our endemic area, and the blue bars are the number of samples, which have drastically declined over recent time, over the last decade. But the key point here is that even with the reduction in the number of samples, we're seeing an increasing trend in the positive, in the number of positive, which is certainly a concern. This is our surveillance plan and how it changes every year, but the gray circles are around wild positives, the yellow circles are around captive positives. Those remain in place year after year. Then we kind of do a rotational focus in other areas of the state to kind of sweep around that southern endemic area. We use messaging to try to compel hunters to have their deer tested for CWD, and then even in electronic registration, we still provide in-person sampling. We also have a statewide hunter service testing policy, so even though we have this surveillance plan every year, if a hunter wants to have their deer tested and they're outside of a dedicated or a target area, we will test that adult deer for them. They just basically have to come to one of our biologists or to one of our established sampling locations. We also this year have some new initiatives, again, trying to get at that carcass challenge, and we have Adopt a Dumpster and Adopt a Kiosk. The kiosk is on the right-hand side. It's a self-service, do-it-yourself, drop your deer head here process. But the adoption part of it is kind of cool because we now have interested individuals and organizations that are basically hosting and paying for these dumpsters and these kiosks to be placed on either their homes or at their business. And it's really taking off, and it's been really popular, and it's a way to really engage the citizens and collaborate with them in this disease management issue that's of concern to everyone. And then we have a new foci action plan for new CWD positives, where now we're going to be working very closely with those citizen deer advisory councils once again, and we do have management action items identified within these templates. So the key there is that the pendulum is swinging back to, I guess, there being more support for potentially taking management actions, provided that we have the support of that local community to do so. Sick deer reporting is a key thing that we advocate for and make sure that our public is aware about it and how to report sick deer to us. That's the best way to detect CWD on the landscape, especially in new areas where there's new detections. And also we want to get those sick deer off the landscape to prevent that source of infection. So we've learned a lot over the last 15 years. We've experienced several phases in management, and yet despite the circumstances of having an endemic area in the southern part of the state, there's still certainly opportunity in the other parts of the state to do something about CWD, and we're hopeful that we'll make progress towards sustained management strategies and working in a collaborative way into the future. If you would like more information about CWD in Wisconsin or our CWD Response Plan, our website and keywords are noted here. So thank you for your attention today.